Celebrating Black History Month, this is Pittsburgh Black History Month 2022. Your health matters. Here's your host, Allegra Battle.
Welcome to Pittsburgh Black History 2022. Your health matters. The state of healthcare for African Americans has always been a cause for concern in the U.S. History has shown that people of color experience lower rates of health insurance coverage, increased barriers to healthcare, and worse health outcomes compared to the rest of the nation. To make matters worse, the COVID-19 pandemic has been devastating in communities of color. The good news is, many lives have been saved and can still be saved through safety protocols, including vaccinations and booster shots. Over the next 30 minutes, we'll focus on what can be done to keep you, your family, and friends in good health. We'll speak to two healthcare professionals, one about COVID-19 and the other about the HIV/AIDS STD epidemic. We'll also have profiles on trailblazers from the past and present making a difference in healthcare. And we have a flashback from our special in 2021 that focused on diversity and inclusion. First up, two history makers in medicine. John McCann reports.
Dr. Rebecca Lee Crumpler was the first Black woman to earn a medical degree in the United States. Born in Delaware in 1831, she was raised by an aunt in Pennsylvania who cared for sick neighbors. It inspired her to care for others, and despite most medical schools barring Black students from education, she earned her training at the New England Female Medical College. Crumpler graduated in 1864, becoming the first female African-American doctor. Many of her patients were poor people who would otherwise have no access to medical care. In 1863, Dr. Crumpler published a book of medical discourses. It featured advice on treating illnesses in infants, young children, and women of childbearing age. Dr. Crumpler passed away in 1895, and her home in Boston's Beacon Hill is featured on the Boston Black Heritage Trail. Now, fast forward to 2020, and with the coronavirus spreading rapidly throughout the world, a Black woman led a team of scientists at the National Institutes of Health in developing the Moderna COVID-19 vaccine. Dr. Kizzmekia Corbett made history during more than 6 years as a research fellow at the National Institute of Allergy and Infectious Diseases Vaccine Research Center. She says her work is motivated by a deep commitment to health equity and that, quote, vaccines have the potential to be the equalizer of health disparities, especially around infectious diseases. In 2021, Dr. Corbett was one of 4 vaccine scientists honored by Time magazine as Heroes of the Year. Dr. Kizzmekia Corbett is currently an assistant professor in the Department of Immunology and Infectious Diseases at the Harvard T.H. Chan School of Public Health.
Locally, Dr. Rhonda Moore Johnson is using YouTube and TikTok to share knowledge in the fight against coronavirus. After a lengthy career at Highmark Blue Cross Blue Shield, she retired and became a health consultant. Dr. Johnson recently spoke with Ty Miller about the ongoing crisis and her mission to help others.
Dr. Johnson, thanks for being with us. Now, you have done a series of videos on social media about COVID-19. Tell us about those videos.
Yes, I started doing them at the onset of the pandemic because there was this misinformation going around that Black people would not get COVID, that we were somehow going to be immune. I knew that that was not going to be the case, and I just wanted to get information out there. So these videos have been on all social media platforms, Facebook, Instagram, YouTube, and now TikTok.
Now, you mentioned in one of those videos that COVID-19 can be prevented. So how can it be?
Well, it's caused by this virus, the SARS-CoV-2 virus, part of the coronavirus family, and it's a viral infection. It's been politicized so much, though. Sometimes we forget this is just a viral infection, like it's far more serious than the cold or the flu, but it's the basic viral principles. So this virus is transmitted primarily in 3 ways, Ty: through airborne, through the air, especially in poorly ventilated places. It can linger for hours. through droplets that get transmitted through the air through things like talking, coughing, sneezing, singing, and through contact. Contact remains a possibility. If someone has an infection, they literally have thousands, if not millions and billions of viral particles in their nose. So if they're touching their, infected mucous membranes, the virus can live for hours on the surface. And if you come immediately behind these surfaces where these viral particles are still viable, then you can pick it up. So to prevent infection, you have to address these three primary routes of transmission.
Let's talk about vaccination. How important is it, and what does vaccination do?
Yes, vaccination has been so highly politicized, and I really regret that. But vaccination primes your immune system so that when your body encounters the real virus, it has a fighting army ready to attack the virus. So vaccines will not prevent infection. You can still get the infection if you're fully vaccinated and boosted. Omicron taught us that, but it helps prevent the virus from multiplying so much and replicating in your body. And if it's not replicating, it doesn't get in all your organs and it can't cause severe disease. It's a very simple concept. So vaccines are very highly effective at preventing hospitalization and death, but they will not stop you from getting infected. And if you get infected, you can transmit the infection to someone else.
Now, there are vaccinations for children now, but many parents do not want to get their children vaccinated. Why should they consider doing so?
Because children are getting sick and children are dying, period. That's why. And the thing about COVID is, just like adults, we don't know who's going to have what type of reaction to this virus. There's no way to predict, really. We know that people are at risk, and some children aren't healthy. Some children have diabetes, some children have asthma, some children were born prematurely, some children have congenital diseases like sickle cell. So those children are particularly at high risk for COVID infection.
Now, I know we're all getting tired of COVID conversations. There's the thing called COVID fatigue. Why is it important to keep these conversations going, even though people say they are sick of hearing about COVID-19, about the vaccines, about people dying, about everything, but it's got to be important to keep this conversation going?
Yes, because we have just been disproportionately impacted by COVID. Compared to our population size in this country, that we have excess deaths. We have excess burden of disease before COVID. We have higher rates of asthma because we live in more polluted areas. We have higher rates of high blood pressure because of chronic stress and discrimination and essential hypertension. We have higher rates of diabetes and obesity. We have higher rates of end-stage kidney disease and dialysis. These are things that continue to place us at risk for worse disease from COVID. That's why Black people need to pay attention to this disease, take it seriously, and get vaccinated.
Battle. COVID-19 has been an epidemic unlike we've ever seen before, and it's shed light on other health concerns. Nationwide, and especially here in Allegheny County, the epidemic of HIV/AIDS and sexually transmitted disease is higher than ever before.
Tell us about the importance of National Black HIV/AIDS Awareness Day.
So, National Black HIV/AIDS Awareness Day, the importance of that day is that we're remembering all those individuals who have been impacted by HIV and AIDS. Many people don't know, but African Americans are disproportionately impacted by HIV. We don't know why, but a lot of times we're the last group of individuals who know their status and we're diagnosed at a later time. So this is a time just to talk about the importance of it and how, it impacts our community. Yeah, so Naturally, COVID has made, everyone kind of stay at home. There's been a bunch of stay-at-home orders, and not had the ability to get out. Also, too, as a result of COVID, a lot of facilities, health facilities, hospitals, have limited their services, especially in the beginning of the pandemic. So that's not different with HIV and AIDS for those clinics who offer those services. So a lot of individuals weren't able to go out and get tested, and because the stay-at-home order didn't feel comfortable coming out. So at that point in time, people who would have routinely got tested didn't get tested.
Now, your clinic offers a number of services for people with HIV or STDs, and they can get tested and other things. So talk about that for us.
We offer free HIV, STD testing and screening. And also, a lot of people don't know, we also offer free treatment for chlamydia, gonorrhea, and syphilis. And we're walk-in clinics, so no appointment is needed.
When you talk about things like chlamydia, gonorrhea, are people reluctant to come forward to say that they have these diseases?
Well, there's still a stigma around HIV and STDs, right? A lot of people don't be labeled having an STD. But again, STDs are part of sex, and they happen, and it's nothing to be ashamed of. When you look at chlamydia, gonorrhea, and syphilis, these STDs are curable. If you even get, chlamydia, gonorrhea, or syphilis, it's curable, so it's nothing to worry about. But even people who have HIV who are diagnosed, with the new line of medications out there coming out every year, people can live long, healthy lives, even being diagnosed with HIV.
Sexually active? See a sore? Seek syphilis and other STD and HIV testing. In 2020, Allegheny County saw a 97% increase in new syphilis cases. Get tested today to know your status. The Allegheny County Health Department's public health clinic offers free and confidential walk-in HIV and STD screenings at our location in the Hill District at 1908 Wiley Avenue. Open Monday, Tuesday, Thursday, and Friday from 8 a.m. until 3:30 p.m. and Wednesdays from noon until 7:30 p.m. Visit our website at alleghenycounty.us/HIV.
You've been watching Pittsburgh Black History Month 2022. Your health matters. To wrap things up, here's Allegra Battle.
African Americans make up more than a quarter of the population here in Pittsburgh. And while Pittsburgh has been referred to as America's most livable city, in December of 2019, the City Council voted to declare racism a public health crisis. With that in mind, Black Pittsburgh Matters is the city's platform to transform Black communities and improve Black people's quality of life. For more information on Black Pittsburgh Matters, visit the website at pittsburgh.pa.gov/BPM/Black Pittsburgh Matters.